Hey everybody, how is everybody doing today? It is Friday. When you find me, say hi in the comments. Let me know that you are here as always. Um, I am doing some bedroom remodeling, so I'm coming at you from my living room today. Okie dokie, okie dokie, okie dokie. Get some hair out of my face and we will get going. Hey, everybody, it is Amy, your friendly chronic pain coach and author, here to talk with you today about osteoarthritis. Um, Osteoarthritis is something that we often get diagnosed with, and our pain is pinpointed with it. It's also called degenerative joint disease. However, it is not a disease any more than graying hairs and wrinkling. So let's talk about that a little today. I want to tell you a story about me and being shown where I have arthritis. Throughout the years, and I'm almost I'm almost 49. I'll be 49 at the end of the month, and with all of the different aches and pains and things that have gone on. I have had various MRIs and x-rays and things to make sure things were functioning as they should be. And I I have arthritis in places that didn't even hurt, but it was pointed out to me that I have osteoarthritis, which is different from rheumatoid arthritis. But I have arthritis in my neck, in my left shoulder, in both hips, in my pubic symphysis, strangely enough, not in my back, at least as of my last scan, and in both knees. So I should hurt in all those places, right? Because I have arthritis, I have degenerative joint disease. Like that sounds terrible, doesn't it? But the reality is I don't have pain in any of those places. You see, what osteoarthritis is it is the wearing of a joint. It is the wearing of cartilage and the visualization of little bone spurs that grow. They happen in almost everybody, and they happen as we age. So it should be no shock that people over the age of 50 are much more likely to have arthritis than people under the age of 50. Now, even though it's a sign of aging, and I would assume nobody is actually in pain because of their gray hair or in pain because of the wrinkles that they have on their face, at least physically. Arthritis can cause pain, and it does. But the neat part is that it doesn't have to. After a couple members in my Facebook group read the blog post that I put out this week on osteoarthritis, a couple people asked, well, Amy, I've got arthritis, everywhere. Is it always going to hurt this bad? And that's a great question. And the answer is no, it doesn't have to. There are millions of people walking around with arthritis that it doesn't hurt. Now, that doesn't mean that it won't hurt them someday, but it does mean that the pain doesn't have to be chronic. We talk about this a lot through Restoring Venus, but pain is always biological, psychological, and sociological. It is our environments. It is the way that we use our bodies. It is the way that we feel about our pain. It is the way that we feel about our environment. It is the access to healthcare that we have. It is our understanding of pain. It's how we deal with the sensation of pain. And it is the biological components, herniated discs, and things like osteoarthritis. But just because you have it, or just because it's seen when you're having pain, it doesn't really mean that it is the cause, like the singular cause of that pain. And I know that's really hard for people to wrap their brains around, but what if it was totally normal for us to have an MRI of our entire bodies every year? What if that was totally normal? And so we could see the changes that are occurring within our joints over time. And if we saw changes when we didn't hurt, would it feel as bad when we did? Like, would we be as frightened? Who the heck isn't frightened of a something named degenerative joint disease? But when you think about it, living is degenerative. I mean, we don't end life the same as we came into it, right? Like, we're taller, we're older, our skin changes, our hair changes, our eyesight changes, right? We lose height. There's all kinds of changes that happen that are degenerative as we age, but they're not. I mean, if living is a disease, then I guess those things are a disease process, or maybe it's just a process of aging. But when that cup gets full that we talk about all the time, when that cup gets full of other stresses, other biological issues, the fear that you're never going to get better, the feeling that life is being taken away from you in big or little ways, then maybe you can't adjust your schedule to work around this pain. And so it continues, right? Maybe you don't have access to proper medical care, or the people that are treating you are making you afraid of a perfectly normal condition. Those are all things that can exacerbate your pain. And that's why, I come live to you and I'm trying to dispel some of those myths and some of those things that are quite frightening. So osteoarthritis is really just your body changing as it ages. I've heard the term wear and tear used. And it is true that people that are more athletic tend to have arthritis earlier. People with EDS tend to have more occurrences of arthritis. Women, of course, have more occurrences of arthritis. And so the more active we are in life, the more likely it is that we're going to end up with arthritis. Another way that we end up with arthritis is the extra weight on our joints if we're carrying more weight than is recommended. Now, that's not to say that all of the pain will go away if you lose weight. Like, I think that's a silly thing to tell people because our bodies are adaptable. But especially arthritis in the knees can be helped with some weight loss. Fun fact for those of you wanting to know how to deal with your knee pain and wanting to deal with your knee pain. But it's really important to remember that when you go in for pain and you go into the doctor and you say, hey, it hurts here, and they start poking around taking images, just because they see the arthritis now doesn't mean it wasn't there 4 years ago. Like, we don't know that is the singular cause of pain, I guess is what I'm saying, that it's all of those other factors combined with that biological finding, if you will. And if we can lower some of the other things, often that arthritic pain will lessen or disappear. People often want to know, well, Amy, what is the best thing to do to treat my arthritis? And you're not going to love my answer. You're not, because it's annoying and you're in pain, and I know that you're in pain. However, the number one best thing to lower arthritic pain is starting with gentle movement. Our joints are nourished by our movement. Now, that may be you laying in bed, bending body parts, and that may be where you're starting. That may be that you take a little walk around the block or around your house or down to the mailbox. That may be that you get back on the pool, or you get on a recumbent bike, or you start going for walks around your mall. But movement of our joints, our spine, our shoulders, our knees, our ankles, our hips, it is movement that creates nourishment. That's literally what brings nourishment to our joints. And we have to move to get the benefits of that. So the longer that we stay in a single position, laying in bed, sitting on the couch, sitting in our chair at work, the more that we stay in the same position, standing at a cash register, the less nourishment and lubrication our joints are getting. And so that's why we need to move. Now, of course, You can try your physical therapy and work on specific body parts around that pain. You can use occupational therapy and make adaptations around your pain for the time being. There are injections that you can try. There are a million different medications. Any medication that works for pain, anti-inflammatories, and depression, anxiety meds. All of those different types of meds are very, very helpful when it comes to managing arthritic pain. You can try your hot pack, you can try your cold pack. It's chronic, so whatever feels best to you is the best thing that you should use. Surgery, as always, is hit or miss. You can't really undo aging. So if your arthritis is so bad that you are unable to move the body part, you just can't. A lot of the time, the orthopedic doctor will describe it as bone on bone, which can also happen without pain. But if it is painful and it has stopped you from being able to move, and you're in your senior years, then maybe a joint replacement is the way to go. Just understand that just because the joint is replaced, that doesn't make it easy. I was talking with a friend the other day, and as a PTA, having rehabbed like a million different knee replacements, I would have to be completely unable to walk. I would have to be wheelchair bound before I personally would do a knee replacement. Plenty of other people would do them in a heartbeat. There's nothing dangerous about them. I just don't want the work of having to rehab from them. A hip replacement, lots of people do that. It's pretty simple. It's pretty straightforward. Don't even have to go to physical therapy afterward as long as you're going to start moving, which is kind of cool, right? I mean, get the joint replaced and then just do the rehab on your own. I mean, you can't beat that. Various surgeons will go in and clean up arthritis on the kneecap, behind it. It's a personal choice and it's yours, but I would encourage you to exhaust all your other options, including working on, increasing your hope, increasing your life, decreasing your fear, decreasing your avoidance of certain movements, increasing your movements before you decide that there's nothing left and surgery is the only option that you have. Because with surgery, you can't undo that, right? Like you can't go back and be like, ooh, I wish, undo it. That doesn't work that way. Sorry, my hair is really sticking to my face today. I also get a lot of questions about the lotions and potions and ointments that, somebody's neighbor friend, Dr. Oz, suggested. And I have dug a little into the research, and I'm just going to be honest. Placebo is great, and we're going to be talking about that later this summer. But save your money and do something else. The research is pretty much that anything that you can buy at the store that's sold for joint pain, it's really no better than placebo. So if Dr. Oz suggested it, I would probably just stay away from it if I were you. Oftentimes topical analgesics like Icy Hot, like those things can be great for managing joint pain. A TENS unit, rock on. Those are great. Like the TENS unit is like when you go to the PT and they put the little stickers on you and they run the electrical current through it and it kind of feels like a little massage. I think maybe you think it's more uncomfortable, but I like the way a TENS unit feels. So you can get your own off of Amazon and you can use it whenever you want. You can ask your PT how you should put the stickers on and how you can use the unit, and they'll be happy to teach you. If not, book a consult with me. We'll talk about it. I'll teach you. They're pretty easy to use. I'm gonna take a sip of whatever beverage you're drinking today. But yeah, osteoarthritis isn't anything to be scared of. Now, you may have to adapt for a time because, that tissue can get really angry and swollen. And like, I know if I were to start walking, my knees would get super angry and they'd probably be swollen for 3 to 5 days. if I started a walking routine without building up to it, I can really irritate them pretty easily. Running does it almost every time. Don't know why. Well, I know why, because I don't ease into it. I'm like, okay, I'm going to do it because it's good for me. And it's too much load on the tissues. So, yeah, it flares up, and then, I gotta like do the things and take the extra Advil and put ice on them and, you know, like slowly go into the activity. But arthritis can be managed, guys. It is not a death sentence. It is not a degenerative condition any more than just being human and being alive is a degenerative condition. It's not a disease process. It's a process of aging. So if your wrinkle, if you consider your wrinkles a disease, then yes, osteoarthritis can be a disease. Now, I will say it can be more likely to happen if you have a repeated injury or accident, like a car accident, something where there's a lot of movement in the body, there's a lot of trauma. Then yeah, it is probably likely that you're going to get arthritis in that space. However, it doesn't mean that it's going to hurt you forever. And I think that's really the takeaway message from today. Is that it just doesn't have to hurt forever. Nothing really has to hurt forever. There are good days and bad days, right? And like the pain goes up and the pain goes down, and there's some days we're able to do more, some days we're able to do less. But it makes me so sad that doctors and healthcare professionals can make you feel like you've got a death sentence because you've got arthritis. It doesn't have to be that way. It just doesn't. So if you would like to know more about osteoarthritis and how to make it more bearable for you, I would invite you to check out my blog post at restoringvenus.com/osteoarthritis. And if you want to know more about pain and how you can manage it and these biopsychosocial things that I keep talking about and taking care of the things in your cup, I have a free course that I would love for you to sign up for. I will leave the link in the description. You get 30 days free access, and it will you're going to learn so much about chronic pain, what it is and what it isn't, and how you can manage it. I appreciate you joining me on this lovely Friday for this video, and I hope that you enjoyed it, that you got some information that you didn't know. And if you would like to continue the conversation, please join me in my Facebook group. I will also leave the link in the comments. And if you like videos like this and you're enjoying my free content, I would love it if you would go to the link that I'm going to drop and just buy me a coffee and help make this content continue. Because as always, there's a cost with everything, right? So if you would like to help me defer the costs from the free content that I put out, go ahead and buy me a coffee. Thanks so much, and I will see you next week when we talk about fear and avoidance and how that can perpetuate our pain. Have a great weekend, everybody. Bye.